Hello friends, my name is Dr. Purudhavan and in this video we will discuss about paralysis. What is paralysis? Why does paralysis happen? How we can restore our mobility in case of paralysis? Everything will be discussed regarding paralysis in this video. So let's start with the term paralysis. Paralysis stands for immobility to move your organ, part or muscle. So when a person suffer from brain stroke, when a person suffer from any kind of infarct in brain or any kind of bleeding in brain, what happens? Part of brain gets damaged. Because of this damage, brain is unable to control your muscles, and when brain get paralyzed, brain is unable to send signals to your hand or your leg. What happens? It seems like your hand or leg get paralyzed, but actually your brain was paralyzed. So we have to start with the cause, we have to start with the root of this disease. We have to understand what is causing paralysis. So most common causes of paralysis is brain stroke, and these brain stroke are two types. First is ischemic brain stroke and second is hemorrhagic brain stroke. In ischemic brain stroke, what happens? Because of clot, there is interruption in the blood supply to the brain. Because of this interruption in blood supply, there is an interruption in the oxygen supply to the brain, and when the oxygen doesn't reach to the brain cells, what happens? Because of this deficiency of oxygen, brain cells, nerve cells start damaging. Because of this damage, brain is unable to control your muscles, your voice, your facial muscles, your leg. Because of all this inability to control these muscles, you feel paralyzed. Similarly, in case of hemorrhagic brain stroke, what happens? Because of high blood pressure, some small capillary or artery get burst in the brain. Because of bursting of the capillary or artery, there is seepage of blood inside your brain. Because of this seepage of the blood, this blood damages the neighboring tissue of your brain. Because of this damage to your brain cells, same thing happens, you are unable to move your arms, leg. So if a person suffer from paralysis because of brain stroke, because of some kind of damage in the brain, we have to start the treatment from the brain. How? I will tell you in this video later. Now let's move to the causes of this brain stroke and see what kind of factors affects the formation of this ischemic brain stroke and hemorrhagic brain stroke. In case of ischemic brain stroke, what we see that if a person suffer from high cholesterol, high sugar levels, body has tendency to make clot in the blood, and this clot of blood may cause ischemic brain stroke. So we have to avoid cholesterol and sugar in a person if a person wants to avoid ischemic brain stroke. In case of hemorrhagic brain stroke, what we see the reason behind it is the blood pressure. If a person suffer from hypertension, high blood pressure, it may cause hemorrhagic brain stroke. So if a person wants to avoid hemorrhagic brain stroke, one has to avoid hypertension. When a person suffers from paralysis caused by brain stroke, what we generally see is that patient is prescribed with the medicines for the hypertension, medicines for their diabetes, medicine for their cholesterol level, even some blood thinner is also advised conditionally, along with some kind of physiotherapy. And within 6 months, a lot of improvement come because brain is healing itself. Brain is doing some kind of neuroplasticity. Brain is making new connection to make control on the muscles. But after 6 months, what we generally see is that improvement which is coming initially was stopped, and there is no improvement even after continuing same medicine, same exercise for years. This is happened because the brain has stopped making new connection. Brain has stopped the neuroplasticity phenomena. So if we want to improve that person further, we have to start the neuroplasticity, we have to start the functioning of the brain cells, we have to start the formation of new connection in the brain, so that brain can make further control on your muscles, so that the mobility can improve. And this neuroplasticity, these new connections can't be made with the help of physiotherapy, because physiotherapy is good for muscles. Physiotherapy is good to make muscles soft, to avoid stiffness, to keep muscles healthy. But if there is no connections, no communication between the brain and muscles, this movement of the muscles won't happen. So in a paralysis patient, we have to work on the both things. We have to work on the muscles also, we have to work on the brain also, so that they can communicate easily and the mobility of the person can come back. To do so, we have to give those medicines which work on the brain function, which work on the neuroplasticity of your brain cells, which helps brain to make further connections to the nerve supply of your muscles, so that they can control those muscles easily. Because of this part is missing in allopathic medicines. These are medicines are not still developed in allopathic medicines. Medicines to improve this neuroplasticity, medicine to increase neuron connections in the brain is not still developed in allopathy. So we have to rely on Ayurveda to make these connections happen, to make improvement in brain cells so that the brain can communicate with your muscles easily. So at Sai Sanjivani, we try our level best to provide all kind of treatment to our paralysis patient, all kind of medicine for their neuroplasticity, to increase their brain connections, to increase their interdendrite connections, to make more connections with their nervous system so that the muscles can be controlled by their brain. We provide occupational therapy exercises which can be easily seen on our YouTube channel so that patient can do those occupational things, those physiotherapy at home so that they can make their brain learn again to control those muscles. Because even after neuroplasticity, even increasing the brain connections, even having control over your muscles, we have to make your brain cells learn how to use those connections to control your muscles. So at Sai Sanjivani, we advise all patients of paralysis, all patients of brain stroke to gain knowledge regarding their disorder, to gain knowledge regarding their what kind of medicine they are taking, what kind of exercise will help to increase their hand movement, what kind of exercise will help their increase their leg movements, because all is happening is in the brain. It's not happening on your muscles level. We have to work on your brain level so that brain can control your muscles easily. Because when you suffer from brainstorm, nothing wrong happened with your muscles, nothing wrong happened with your bones, everything is all right. We have to work on your brain so that brain can communicate with your muscles easily. To do so, we have to do lots of things. We have to increase the brain functioning, we have to increase the brain interdendrite connections, neuron connections, nerve supply, and make them learn how to use those new connections to control your muscle. Now, if you have any kind of question, query regarding paralysis, brain stroke, you can simply ask on the number given below. You can also visit our clinic. Now, if you have any kind of question, query regarding paralysis, regarding brain stroke, you can simply ask on the doctor's team on the number given below. You can also take an appointment with me on the same number given below. You can also visit our website. You can also visit our website, saisanjivani.com for further information. With this, allow me to say goodbye. See you in the next video.